Good evening, class. It's quite a while we've been missing classes. It is not too good for us, even though we are almost more than halfway of our class. We are to continue from Unit 2. Once more, my name is Musa WAZIR. I'm to take you community nursing. We are to continue from Unit 2, starting with prevention and the control of communicable diseases. When we say prevention and the control of communicable diseases, this refers to the prevention or containment of diseases that can be spread from one person to another. And it involves some measures such as vaccination, provision of clean water, knowledge of preventive interventions to reduce the risk of infection and the benefits both individuals and the communities as whole. So this is just telling us that to prevent and the control of communicable diseases, it requires some measures, which are vaccination. When you give vaccine to prevent infection, it's okay. It's prevention. You give clean water, which is a medium to prevent the occurrence of infection. You give people awareness and the knowledge on what causes diseases and how to prevent the diseases even if someone is already contacted. How to prevent the communication also matters in the control, and also to reduce the risk of the infection. And the entire processes or measures benefit both individual and the entire community. To reduce the spread of diseases from one person to another, those measures can be included: vaccination, hand washing, sanitation, safe food handling, safe sex practices, avoiding contact with wild animals. Yes, we know most wild animals carry parasites that can easily sneak from their body to human body and relatively causes infection. Some can only sting you, releasing some substances that can also causes infection. And we also mentioned sanitation. Yes, we all know what is sanitation. Cleanliness of environment to avoid germs and many other bacteria that might have existed in that area. The hand washing, yes, to relieve our hands from contaminations by washing. We know what is vaccination: to prevent, to give the body immunity against the existing bacteria that were in our surroundings. Then we all understand what is safe food handling. We started from the processes, that is cleanliness of the raw food, then adequate cooking as supposed to, then also well kept if cooked, covering, and so on and so on. Then we also know what is safe sex practices. Either you stink to your life partner, such as wife. If you are not that of the wife, you are maintaining girlfriend, maintain only one. No, or if sex have to occur illicitly, then use condom. That is simply for safe sex practices. Then avoiding contact with wild animals. As I said, some wild animals also contain germs or processes germs that are not even harmful to them. It serves in their body as normal flora. So when humans get contact with them, they become issues. We have social distancing. Yes, when you stand at social, you limit or you restrict the sharing of breath, and also living in two congested area together also. Then using face masks, yes, this barriers the existing bacteria within the air that we're inhaling. Then using insect repellents, yes, this can even repel so many insects from giving you instincts, from stinging you, particularly when you're outside, particularly in the evenings, and most especially around bushes. We have numerous of several insects that does that, not only mosquitoes. Then taking prescribed medications. Yes, there are some preventive measures to this when you approach or when you went to where you are anticipating some of these things, you take preventive measures. Like the tete fly, we have preventive measures for them. Like even mosquito bite, we have some preventive drugs to take not to have malaria after you have malaria contact with several mosquitoes and so. Then we have concept of communicable diseases. Communicable diseases are illnesses that can be spread from one person to another, and they are caused by germs like bacteria, viruses, fungi, parasites, or toxins. They are also known as infectious or transmissible diseases. I think this is self-explained. Communicable diseases means that diseases communicate from one person to another. So that is just, it's spread. There's another word for that. Then many diseases are communicable, and some of those include HIV, a major global health issues. HIV is a sexually transmitted infection. We have tuberculosis, that's the TB, commonly known in abbreviation TB, the second leading infectious killer in the world after COVID-19. We have malaria, but we have the TB of spine, bones, many other parts, even the blood and so on and so on. So, and each of the TB is deadly. We have that of the lungs, we have that of the bones, we have TB of the skin, we have TB of the blood and so on and so on, and they are all deadly. Then we have malaria, a disease transmitted by the bite of the anaplex mosquito. Anaplex here means the female type of mosquito. Then we have the viral hepatitis. This is from viruses, a disease that can be spread through exposure to infected bodily fluids from the blood, body plasma, saliva, and so on and so on. Then we have influenza, which is from flu, a disease that can be spread by coughing, sneezing, and saliva or mucus or unwashed hands that are infected with the salivas or the mucoid. We have influenza, we have coryza, they're all alike and they're all flu and they're all viral infections. Then we also have prevented, control, and eliminate. We have some communicable diseases that can be prevented, also can be controlled and eliminated. But unfortunately, many of those are being neglected. Such are some of those infections are ringworms, a skin disease caused by fungi, which is the skin gets inflamed with noodles on it, and so it has some characters like itching, turning the skin whitish, and so on and so. That is ringworm. Then we have athlete's foot, a skin disease caused by fungi. This normally and usually occur in between the foots, particularly the wet foots, either foots being always being enclosed in a covered shoe or in dampy areas, always being water. Usually they come up with this. And it also has some characters like heredity, particularly when your parents usually have it, you are also bound to possess it during your own time. Then we have West Nile virus, a disease carried by mosquitoes. Some of these include dengue, fevers, and so. Then we have Lyme diseases, a disease carried by deer, ticks, or black leg ticks. We all know what is ticks. In the Hausa language, we call it koti. Ticks is always sticking to animals, particularly hairy animals, like the dogs, sheep, and so on and so on. gets himself buried in their hairs and attach himself to their skin, and it sucks blood. Mainly, that is what it does. And if there are so many, they will suck the blood of an animal until the animal became anemic. Other communicable diseases include most common forms of spread includes fecal oral, food, sexual intercourse, insect bites, contact with contaminated fomites, droplets, or skin contact. These are most common forms of spread. Then we also have communicable diseases can be spread in many ways. Through physical contact, touching an infected person or contaminated objects. Sexual contact, diseases like chlamydia, gonorrhea, and the syphilis. They were all sexually transmitted through sexual intercourse. Then we have fecal oral contact, diseases like rotavirus, polio, and etc. These are mostly being defecated on land, and the water gets it washed to our rivers or washed on plants like vegetables and so. So when consumed without being adequately heat to kill these germs, it will definitely, to kill this virus, it will definitely get back to human through oral consumption. Then we have uh, respiratory droplets, diseases like influenza and the mumps. They are all viral infections. They can get to one another through droplets of salivas from sneezing or speeches and contact with the mucoid or salivas. Then contact with blood, diseases like HIV, hepatitis B, C, and so on can be contacted through the blood and blood products, either in a multiple or single droplet of a splash. Then contact with foods, diseases like salmonella and the E. coli can all be gotten from fruits, vegetables, and so on, that are contaminated with these organisms. Then contact with water, diseases like cholera and many others can be flow and acquire through drinking contaminated water or through injection of contaminated water. Then we have insect or animal bites, diseases like West Nile viruses, Lyme diseases, and rabies, all are from animal bites. Then we also have breathing in diseases like tuberculosis and the measles will be inhaled in and transmitted to another person that inhales either the warm breath from a contaminated person. Then we have general principles of control of communicable diseases. When we say general, it means the entire things or activities to do to make sure that these diseases are being controlled, or the source of contacting these diseases or the means of spreading these diseases are well managed. The general principles for controlling communicable diseases includes eliminate the source of infection. Yes, when we say eliminate the source of infection, mean identify and reduce or eliminate the infectious agent at its source. For example, if it is just an entity of animal you have that is highly infected and probably killing or eliminating the animal and bury it may save the matter from being spread, then you take that measure, and that is elimination. Then cut off the roots of transmission. Break or interfere with the ways the infectious agent is transmitted. In this form, you can isolate the infectious animal or person from other people so that there will be break off from interference, from interactions, and so on. Then protect the susceptible population, meaning that you should identify and reduce or eliminate the susceptible of vulnerable people or population. This also involves isolate people like elderly people and young children that has weak immunity. You can prevent them from being where these hazards are available, and sometimes even give them vaccination to prevent those measures. They will also have vaccinate. This is generally to boost or to grow immunity in individual against some specific infectious agents. So immunization is a cost-effective way to control and eliminate infectious diseases. So we have communicate, meaning that give information. That communication is key to maintaining trust and transmitting vital information, and also health talk. This is to enlighten the community on the existence of those uh, diseases and the measures to prevent measures for individuals to prevent themselves from coming in contact with the specific diseases that were mentioned. Then other principles of controlling communicable diseases includes rapid assessment to determine the population health status and identify the main disease threats. This is an activity by the health worker. Determine the population's health status and identify the main disease threats. This is done by the health workers that are concerned. They quickly check and determine the population's health status, meaning that how far, how long, how when the disease has infected or impacted in the society, and as soon as possible come up with the preventions measures. That is to provide basic health care, food, water, shelter, and the sanitations to boost the community resistance to infection. Then we have surveillance. They monitor diseases, trends, and they detect outbreaks for proper interventions and measures and communications so that other communities will be given measures against the windfall. Then we have outbreaks. This outbreak control. These are response rapidly to outbreaks by confirming, investigating, and implementing controls. I think when we have outbreak, there is a need for quick response to determine preventive measures also, and also communicate other regions, other communities to quickly take intervention. Then disease management. This provides prompt diagnosis and effective treatment to cure particularly those that were infected. Then we also have a component of general principles and the control of communicable diseases. When we say component, it means all it will comprise to achieve general principles of the control or general control of communicable diseases, which are notification. When we say notification, is to notify the health workers, to notify the policymakers that decides what to be done in the community or in the society or the entire state in putting laws and measures to prevent or to take control of the communicable diseases or the spread of the communicable disease. Then we have early diagnosis and the prompt treatment. Yes, when you quickly identify the disease persons and you quickly treat them before they spread it, it's also a better one. Then we have reporting. Without reporting, no health worker will know that there is spread of a disease. And no one will know the ratios on ground to determine either it's outbreaking or the disease is spreading. We also have a measure called isolation. When you cough the people that are being infected, it will minimize their interaction and contact with other people to get them infected. Then also disinfection. 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 We know when we say disinfection, is to remove all bacteria or germs from any other material or surfaces. They will also have these infestations, and this is also to kill the sources. If you can kill all the rodent, all the insects by what they call these measures we do in our homes. Oh my God. What do we call this? When you close all houses and fumigate. Fumigate. By fumigating your environment or places like that to kill all the causative organisms or the transmitting vectors and so. Then we have immune prophylaxis. Give immunity to provide protection. Then we have chemo prophylaxis. You give medication to prevent the occurrence of those diseases. Then we have health education. When you give people a level of knowledge of awareness, they will be able to manage themselves to avoid all that will cause or what will expose them to those causative organisms or those that are infected. They will be able to take measures such as washing hands, use of masks, distancing, and so on and so on. With this knowledge, they should be able to take care of themselves like that. Then surveillance. The surveillance is a measure by the health workers to watch out, to search for the existing infected individuals so that they will also manage them. Then we also have measures like practice to control gastrointestinal infections. You can practice good hygiene, avoid contaminated food and the water, avoid contact with sick people, get vaccinated, cook food thoroughly, take precautions when traveling. Yes, when you travel to where you are not used to, you don't know the source of their water, you are not used to certain foods they eat, take precautions. Even the water they drink, they may have adopted to ingesting some particular organisms while you are not. Then take precautions to prevent toxoplasmosis. These are also contact with animals, you understand. Then we also have gastrointestinal infections can spread through contaminated food, water, or contact with infected individuals. They can lead to outbreak in communities and regions. Most gastrointestinal infections are mild and self-limiting, but you should see a doctor right away if you have a fever above 40 degrees centigrade or 104 degrees Fahrenheit, which is equivalent to that 40 degrees centigrade. There are inability to keep liquid down of 24 hours. Vomiting for more than 48 hours. Vomiting blood, becoming dehydrated are all issues with gastrointestinal issues. We also have helminthics. Helminthics. Helminthics infections can be controlled through a combination or deworming, health education, and improved sanitation. Helminthics, in other words, refers to intestinal worms. Intestinal worms. So deworming, the World Health Organization, WHO in abbreviation, recommends that people at risk of helminthics infections receive periodic treatment with antihelminthics, that's deworming medicines. At-risk people include preschool age children, school age children, and the women of childbearing age. We understand all these things. Why are they like the vulnerable people? We all know and understand that the school children often fasting eat anything that comes their way. Sometimes they store their food from morning to closing hours, and some of the foodstuffs or foods are not too okay to be kept for a longer period that way, or they were not properly kept, or the preservative system of that nature of food by those hours may have gone wrong. And they eat a lot of locally made sweets and so on and so on in the schools. Then the foods sold by local micro vendors, which most are not made under good sanitary or hygienic situation. And also, the the level of their neatness is not also adequate. They play around with their hands anywhere and get it leak again within a short time of contact with some bad surfaces that might have contained some, fetish. Also, for the women with childbearing, most of them carry children around, and they can easily get contaminated because the children also, the case sometimes they wash them like that, and without proper cleaning of themselves from that, and sometimes they pick the children from also grounds, surfaces that were contaminated, and so on. So many things made them factor. Then we have health education. Health education can help prevent reinfection. When you are aware and you have the experience, it will be okay for you to know what to do to prevent reoccurrence. That is just what that means. Then sanitation. Let's improve the sanitation and can reduce soil contamination with infected eggs of bacteria. Then we have hygiene. This hygiene can reduce the probability of uh, sexually transmitted infection or any other thing. You understand? Think. So next slide now. Also, control of infections through skin and the mucous membrane in human. To control infections transmitted through skin and the mucous membrane. Contact. The crucial practice is good hand hygiene by regularly washing hands with soap and water, especially before and after contact with others, and using alcohol-based hand sanitizers when soap and the water are not available. Additionally, covering wounds and practicing proper respiratory hygiene, like coughing or sneezing into a tissues, are key elements in preventing infection spread through human contact. I don't know if you get it clear. What we're saying is advisable when sneezing, you should cover your nostrils and mouths. And at the same time, washing hands with soap and clean water regularly is also a good one in preventing this. Then also, use of alcoholic-based hand sanitizers are also a good practice to prevent transmission of diseases as it washes and kills small bacteria and germs. Then also sneezing or coughing into either tissue papers are also a good measures to prevent the spread into air. So I think prayers time is fast approaching. Then we have key strategies to control infections through skin and the mucous membranes via human contact. Hand hygiene, which we earlier discussed, personal protective equipment, PPE, that is the tarpaulin dresses that is not permeable to allow crossover infections to the body. Then respiratory hygiene, then wound care, safe practices in the healthcare settings. We all know what is safe practices in healthcare setting. Use of personal protective equipment is one of them. Use of gloves, face masks, and no sharing of even gloves between patients and so on. Then also proper hand washing and so on. Then educating individuals about infection control also takes us a long way in control of infection. So we also have important considerations, that is transmission's routes. Understand how infections spread through direct contact, skin to skin, or indirect contact as through contaminated surfaces. So specific situations, adopt infection control practices based on the type of infections and the risk level, e.g. high risk healthcare settings may require additional PPE. High risk settings, like where they keep people with COVID cases. The staffs, nurses, doctors there are required to use personal protective equipment. Then we have compliance. Ensure that all healthcare workers and the individual adhere to proper infection control practices, meaning that everybody should comply to the rules. Use face masks, use hand gloves, wash hands, all are the rules that individuals need to comply with. Then we have sources, other sources. There are several ways to control infection through other sources, which including hygiene, washing hands and the soap. And so washing hands with soaps and water is the most important way to prevent the spread of diseases. Other hygiene measures include covering cough, disposing of garbage regularly, cleaning and disinfecting surfaces, changing bed linens, towels, and the gowns regularly, change of towels, gowns regularly, cleaning mobile devices regularly, probably with uh, methylated spirits to disinfect its surfaces and also avoid it getting soiled with water. I think we should hang up here and continue in the next class from where we stop. I think we're okay for the day. Thank you very much. I think by tomorrow or next tomorrow, I should be able to see you again in another class. Thank you very much for your attendance.